certainly can create a raving fan in your practice if you can help individuals to really get at the roots of their pain and help it to go away, rather than simply having to manage pain on an ongoing basis with medications. Welcome to Functional Medicine for Real-World Impact, where we're diving into the complex, interconnected nature of health and disease, exploring not just theory, but practically what it takes to turn functional medicine insight into powerful, practical, real-world results. So please hit subscribe and let's get started. This is Tracy Harrison from the School of Applied Functional Medicine, and I want to invite all progressive healthcare practitioners of every modality to come over and join us here at SAFM for our monthly clinical education broadcast. For today's session, I'm going to be talking about the gut-brain pain axis and key points of interconnectedness that help to precipitate or relieve pain that are often overlooked, that all practitioners realistically need to know. Regardless of your expertise, whether it's autoimmune disease or fertility or metabolic disease or immune hypervigilance, being aware of the gut's role in precipitating systemic dynamics is absolutely essential. But I want to dive right in because I have a lot to talk about today. And in particular, I want to talk about the notion of reframing pain because maybe not us, but certainly the people we support in our practices are used to thinking about pain being a negative, something we just want to squelch, numb, make it go away. And I think it's important to remember, as most of us know from our training, that pain is not something that's actually caused by a direct stimulus, especially when we're talking about chronic pain that has an ongoing stimulation and dynamics in the human body, keeping it alive and well. Ultimately, pain is something that our nervous system tells us to feel in order to help us to recognize and respond to a danger. Now, if this is acute and we're in some physical danger, obviously this is super important. It often is acute pain as well. And we take the immediate clue and we change our situation, our environment, right? We rescue the dynamic. But so many people that you are supporting in your practice who are dealing with chronic pain are struggling with a chronic functional imbalance, often several overlapping ones in their body that are overtly precipitating the pain. And unfortunately, the typical approach of using a non-steroidal anti-inflammatory drug, while it may bring some relief and it may be absolutely necessary for really dramatic pain that is chronically preventing sleep and therefore chronically preventing healing, because healing requires sleep. It's not optional. The reality is that using these medications on an ongoing basis in order to counter pain has immense consequences. Non-steroidal anti-inflammatory drugs are known to be, this is well understood, overtly erosive to the mucosa in the gut, which with ongoing use can contribute to a huge variety of issues. In particular, you may see it be the beginning of a whole secondary disease dynamic in the people you serve. They may have had an injury or some kind of accident or some kind of pain scenario crop up, and they started using, say, ibuprofen once or twice a day for a period of time on an ongoing basis. You may be able to point back to that choice as being the beginning of some dramatic dysfunction in the gut that then spread systemically to some other disease dynamic, anything from an autoimmune disease to fibromyalgia to insulin resistance and metabolic dysfunction. Yes, can have their roots as something as simple as consuming too much ibuprofen. Because when we're doing overt damage to mucosa over time, we are likely promoting a number of dysfunctions in the gut. Perhaps most importantly is you don't have to take that much ibuprofen in order to damage the mucosa enough to start to impair our ability to absorb nutrients. So even if we're eating a healthy diet and well digesting it, we can't absorb it if there's ongoing damage that the drug is interfering with our ability to repair it. in the gut lining. And so we can end up not absorbing enough zinc in order to help boost our immune system. We can not absorb enough magnesium to help us to have optimal blood pressure. We could not absorb enough chromium to have us have optimal insulin sensitivity, right? All biochemistry in the body runs on micronutrition, and we must have excellent nutrient absorption in the gut in order to enable that. And these drugs interfere with it. Or for that matter, people may choose not to use ibuprofen, but to use acetaminophen, which is overtly toxic to the liver and uses up our precious supply of glutathione in the liver in order to help detoxify this medication. It's a wonderful reminder that all drugs are toxins. That doesn't mean they can't be incredibly useful and a real blessing for a period of time for a particular purpose. But when we're relying on them on an ongoing basis to be the solution, it is going to be at a cost. There's going to be a consequence. And so while these medications for pain may be necessary or of value for a short period of time, we want to get at the roots. Ultimately, we've got nociceptors throughout the body in many different tissues, right? We have pain receptors in muscles and blood vessels and nerves and eyes and skin and subcutaneous tissue. They're everywhere. And so they can be triggered by a whole bunch of different factors, irritation, stress, trauma, these types of things. But in this day and age, in our typical cultural environments, the vast majority of pain is being triggered by inflammation. And the roots of inflammation for the vast majority of the people you serve are in the gut. In the gut, because inflammation is the response of the immune system. And you've sure heard the adage, I'm sure, that over 2/3 of your immune system resides in your gut. If you were responsible for defense and repair of the human body, you would probably want to hang out in the gut as well, because that's where you're going to be able to most accurately surveil what is the status of our world? What's coming in terms of nutrients, in terms of toxins? What is the health of the microbiome as our supportive defense, our digestive support, our biochemical support? What's going on in these environments? So we know whether in general to adopt a parasympathetic nervous system mode, which promotes rest and digest and fertility and healing, or given the sensing that the immune system is doing to a large degree in the gut, does it make sense to be in a sympathetic nervous system mode that is not prioritizing vitality at all? It's not prioritizing healing or fertility or any of that. It's prioritizing survival. It helps us to fight, flight, and hide in the name of survival. And when you have a more active sympathetic nervous system mode on an ongoing basis, on a chronic nature, you have a greater experience of pain. You are predisposed to experiencing pain in a more overt way. This is part of how the body helps to warn us of danger so that we can protect ourselves. And this is important because many of the people we're serving in our practices through the functional medicine lens are spending an awful lot of time in a sympathetic nervous system mode, right? We deal with huge amounts of stress, mental stress, emotional stress, social stress, professional stress, relationship stress, lots of mental emotional components of that. But what I want to really emphasize today in particular are sources of physiological stress, because you don't have to be really upset or ruminating or worrying or anxious in order for your body to be experiencing strong chronic stress because of physiological factors. And this can run the gamut of many things that your patients aren't even aware of. Things such as sleep apnea that can lead to people feeling really tired the following morning and lead to chronic fatigue. And often is treated as more of an annoyance because people don't feel well rested. But when you're experiencing sleep apnea, this is acute stress as far as your body's concerned, because you can't breathe. And this is an acute stress that causes not only aggressive surges of adrenaline in the moment, but it primes you for higher levels of cortisol all throughout the next day as well. And this can be a huge contributor to all sorts of metabolic disease, but it also increases increases your pain perception, makes you more likely to feel pain and to feel it more strongly. And so whether it's sleep apnea or exposure to a toxin or a brewing infectious dynamic in the body, these are simple examples of physiological stress that even if a person has a great life outlook and they have great relationships and they're happy, the body itself is still stressed. And this is going to increase our stress hormones and increase our perception of pain. And so it's important for us to do an investigation and understand where we have these brewing dynamics. And certainly we know that this infectious dynamics can come from viral challenges or fungal or bacterial or parasitic challenges. But I want to talk in particular about the widespread incidence of imbalance of microbes in the gut. Dysbiosis. And this can mean anything from the presence and low levels of a novel pathogen to the opportunistic overgrowth of a really well-adapted species like Candida albicans in the small intestines or Helicobacter pylori in the gastric cavity. Or it could speak to a yeast or fungal species, it can speak to a bacterial overgrowth that is caused by translocation, such as when we don't have good ileocecal valve function and we get a migration of microbes from the colon where they're way more prevalent, several orders of magnitude more prevalent in the colon, but we get a migration of some of those species back up into the small intestines where they can overfeed on debris from our diet in the small intestines and aggressively overgrow and create what we might refer to as a small intestinal bacterial overgrowth, where there's not actually a novel pathogen. What there is more of an opportunistic pathogenic dynamic where a species we expect to find in the human microbiome has overgrown. And this can end up having an overt influence on our pain perception because dysbiosis creates inflammation, right? Even though these are commensal species, the hyper presence of the immune system in the gut well recognizes that this overgrowth is of a strange presence in the body, and it is a dangerous presence in the body. And so it triggers more inflammation. And as the immune system goes to counter and fight this overgrowth, we get oxidative wear and tear to the mucosa. Based on the byproducts of the overgrowths in the gut, we can end up with either lower or higher levels of serotonin production in the body. And either of these, really high levels of serotonin production in the enteric nervous system in the gut, or really low levels, can play a key role in precipitating higher levels of pain. In fact, it's a common dynamic, for example, that low levels of serotonin are overtly associated with higher pain perception. For example, if there's an overgrowth in the gut that's producing a lot of methane as a byproduct, a microbial byproduct, this has been shown clinically to reduce the production of serotonin in the gut, which can lead to dysmotility and constipation, but it can also enhance our pain perception. It's a fabulous reminder of just how powerful and primal the enteric nervous system is in the body. And in fact, that's where more than 90% of human serotonin is made. And a whole slew of neuropeptide synthesis happens in the enteric nervous system as well, including things like substance P, which plays a huge role in pain perception. But to keep in mind that these critical neurotransmitters that you likely know play a huge role in pain and mood, right? If we have challenges with neurotransmitter imbalance and it promotes more anxiety or more depression, we're also going to have a predisposition toward more pain. And so what's happening in the gut in terms of modulating the neurotransmission and the neuropeptide synthesis there is playing a huge role in what our perception of pain is going to be. You and I could be exposed to the exact same circumstances, but our actual experience of pain can be markedly different depending on our physiological state. As I've already said, our nervous system state, the level of inflammation in the body, and now including the levels of various neurotransmitters in the body. So keeping good microbial balance in the microbiome throughout the GI tract is an essential part of being able to minimize pain. And there are many people at SAFM, we see this all the time in the case examples we review as a community. The roots of chronic pain, in particular things like fibromyalgia or chronic fatigue, are often involving a chronic simmering infectious dynamic in the gut, that the immune system is strong enough to fight and counter and create lots of oxidative wear and tear, but not strong enough to completely resolve in order to eradicate. And so this makes us really quite vulnerable for the gut to be the roots of truly systemic pain. And so this is an important consideration if someone comes to you and they may have notable pain in certain joints or certain key points in the body. We always want to be looking to the gut to understand what might be at play there. Now, in terms of a dysbiosis, it's important to realize that this can naturally occur on the other side of antibiotics. And if you've been studying functional medicine for a time, you know that an awful lot of secondary or tertiary disease ends up getting kicked off by a big course of antibiotics. And sometimes that's a necessary consequence of a blessed use of a drug that was absolutely necessary for wiping out a dramatic infection. But we also know there is still a challenge, especially in conventional medicine, of excessive and then sometimes completely unnecessary use of antibiotics. Because every time we use one, we fuel the growth of antibiotic resistant species. We pave the way, we roll down the red carpet, basically encouraging their overgrowth and their creation of inflammation. It can also be an overgrowth of a species that this particular medication is naturally not designed to counter, such as a typical antibiotic designed to counter bacterial species often naturally promotes overgrowth of yeast and fungal species. And so a medication, again, can be at the roots of this, but there are other common dynamics such as maldigestion and dysmotility that can set us up naturally for an overgrowth. And that overgrowth is going to change the dynamics in the enteric nervous system. It's going to increase inflammation and promote greater predisposition to pain. So this is an interesting chain of interconnected causality. Many, many people in your practice have maldigestion. They may struggle with having suboptimal levels of stomach acid in the gastric cavity. This may be purposefully because of use of a proton pump inhibitor or an H2 receptor blocker because of acid reflux. It might be because of an overgrowth of H. pylori in the gastric cavity that I mentioned earlier, which is a little bit of a double whammy because the overgrowth is promoting maldigestion that's going to go down and create other inflammation in the small intestines. But we also tend to produce less stomach acid. We have progressive hypochlorhydria as we age. And this can lead to maldigestion. And you see this in your patients who have quite a bit of belching or early satiety. They get halfway into their meal and they feel full too soon, or they feel this upper GI distension and fullness, right? Or that belching, or that during the meal acid reflux. Give me a thumbs up if you see this in your practice and you note that this can easily be evidence of hypochlorhydria that you need to address. Because here's the thing, stomach acid is an essential part of digestion. And when we're not making enough, or when we purposefully take a drug to suppress it, we're actually busting our digestion. because we need good, strong stomach acid to degrade food, right? We chew up and swallow our food in a bolus. Hopefully we chew it quite a bit in order to allow the only part of digestion that's voluntary to be as effective as possible. So ideally we chew quite a bit. We have good eating hygiene and we really break down the food. We chew it until it's almost liquid. And then we swallow, and then the whole rest of the GI tract has to deal with what we did or didn't accomplish with our chewing. But we need good, strong stomach acid in order to help to separate the various components of food from one another so that they can be well acted upon by digestive enzymes. And in particular, good, strong stomach acid helps to denature proteins. Now, the word denature basically means that it's helping to unwind the protein complex. Think about a protein as being like a tangled ball of yarn, right? Tangled ball of yarn. It's really hard for digestive enzymes to get in there to cleave individual polypeptide chains or to separate out individual amino acids. We want good, strong stomach acid to unwind the ball of yarn into these looser chains where it's easier for digestive enzymes to do their job and isolate nutrients to enable their absorption. If we don't do this, we're much more likely to lose more nutrients, more micronutrition from our food in our stool. And so having good, strong stomach acid is really key in order to denature proteins so that we can absorb amino acids, to separate minerals from the protein complex. Otherwise, they are also hard to separate and absorb. And we need good, strong stomach acid in order to activate strong binding of intrinsic factor with vitamin B12. Absolutely essential for vitamin B12 sufficiency that we have good, strong stomach acid. And a lot of people in your practice have challenges with suboptimal status or inadequacy of vitamin B12 for their unique physiology. And I'm going to come back to that in just a moment because inadequate vitamin B12 can overtly contribute to higher pain. A common known dynamic because vitamin B12 overtly nurtures nervous tissue, in particular the myelin sheath of our nerves. But we need good, strong stomach acid actually to activate, create the good pH, the more acidic pH that allows our digestive enzymes to be effective further down in the small intestines. So the message here is that if you're working with someone who's using a proton pump inhibitor in particular, because they're stronger than H2 receptor blockers, but realistically either drug, where possible, where a patient is curious and ready, willing, and able to embark on lifestyle change, we want to partner with them to remove the need for these medications because as long as they're using them, we're purposefully creating hypochlorhydria. We're purposefully busting digestion. We're purposefully increasing the risk of downstream dysbiosis in the intestines. And this can overtly promote disease. And so, again, another great example of how a medication is a blessing, but in the gut with chronic use, it can be part of the problem and set off a whole additional cascade of systemic dynamics. But the other thing that we need to ensure is that we have good, strong digestive enzyme function in the gut. This is another way that the roots of pain can be in the gut. We need the pancreas to produce good, copious, diverse levels of digestive enzymes. And what many practitioners are not looking for is that in all of your patients who are wrestling with some type of insulin dysfunction, whether this is hyperinsulinemia or prediabetes or full-on type 2 diabetes, or actually autoimmune type 1 diabetes, or even combination types. Research shows that once the pancreas has begun to struggle for any reason to produce optimal levels of insulin, which is an impairment in the pancreas endocrine function, it's also evidence that the pancreas is very likely to be struggling with its exocrine or digestive function. depending on the study you look at, 25 to 50% of people who have some challenge with metabolic disease are not putting out enough digestive enzymes. And if you don't, through the combination of good, strong stomach acid and lots of digestive enzymes, degrade food well to enable the ready absorption of those nutrients, what we're actually doing is encouraging the overgrowth of microbes, because we're making too much debris from our diet readily available. Microbes are, of course, competing with us in order to take advantage of fueling themselves with nutrients from our diet, right? Sugars, starches, fiber, fats, amino acids, right? It's been shown that microbes are quite resilient metabolically and can use an awful lot of excess food fodder from our dietary buffet in order to opportunistically overgrow. And this is especially true if people have experienced that small intestinal overgrowth where we've gotten that migration of bacterial species that most often are thriving and are most populous in the lower colon. They're migrating back up into the small intestines where a lot of digestion is taking place, where by definition there's a lot of food fodder still there awaiting final breakdown and absorption. And so these microbes are thriving and they're producing lots of byproducts. And this can be really promoting tremendous inflammation as the immune system in the small intestines tries to suppress this overgrowth, tries to fight it. And the immune system is breaking down these bacteria in particular. And we are isolating a lot of bacterial parts, bacterial debris, components. And several of these, in particular lipopolysaccharide, which is part of the outer membrane of gram-negative bacteria, which are quite populous in the gut. If we're promoting a lot of lipopolysaccharide being freed up because the immune system is having to counter these overgrowths, then lipopolysaccharide acts like gasoline thrown on a fire. It overtly triggers higher levels of an inflammatory mediator called NF-kappa B, which aggressively increases inflammation and increases pain perception. Those higher levels of lipopolysaccharide can also contribute to a loss of barrier function in the gut. And I'm sure all of you have heard of the concept of leaky gut, right? Give me a thumbs up or a heart if you're well familiar with this concept and you reference it and use it a lot in your practice, right? We want to be looking for where there is loss of barrier function, in particular in the gut, because it means the craziness that's in the gut with regard to immune battle and all this oxidative wear and tear and inflammation. When we lose our barrier function, we're getting more systemic exposure to what should be well contained in the gut. And this is where I want to introduce the concept of the gut-brain axis. I actually think it's more accurately called the microbiome gut-brain axis, because what happens in the gut often does not stay in the gut. And it's been well demonstrated that when we get the immune system strongly reacting to dysbiosis in the gut, and we're producing a lot of lipopolysaccharide, and we're producing a lot of inflammation, that when we lose barrier function and the systemic body is exposed to this, certain inflammatory mediators, certain interleukins, like interleukin 6, for example, which is highly triggered in response to lipopolysaccharide, can have a negative impact on the integrity of our blood-brain barrier. Yes, and so this makes us more vulnerable to neurotoxic effects and neuroinflammatory effects. The blood-brain barrier is supposed to have even more well-regulated control than the gut barrier does and protect, if you will, the inner sanctum of the brain and central nervous system from these transient toxic and inflammatory effects in the systemic body, in systemic circulation. But interleukin 6 not only increases the permeability of the blood-brain barrier, it allows those interleukins in order to get into the brain and to affect our neurotransmitter receptors. And some of these inflammatory mediators, in particular ones that are common from the gut, increase receptor activity for glutamate. Now, many of you are familiar with the GABA glutamate balance, right? The importance of keeping balance in the body between GABA, the body's most prominent inhibitory neurotransmitter, and glutamate, right? We need to keep a balance in these things. And when you have more glutamate transmission, you're going to feel more pain, and the pain you feel is going to be more acute. It's going to feel more debilitating. And so this is where stress, anxiety, these types of things promote more glutamate. And this naturally increases pain perception. And we need good GABA glutamate balance in the body. And there's certain aspects of just normal life that can shift this balance. Women, for example, as they enter perimenopause and they have lower levels of progesterone, or perhaps individuals who may struggle with lower progesterone because of other infertility dynamics like PCOS and other anovulatory diseases. When your progesterone goes down, your GABA goes down, and you end up with a relative glutamate GABA imbalance. And this is going to increase anxiety, it increases wakefulness, it increases pain perception. And so we need to, there's lots of ways in which we can end up with GABA glutamate balance, but a lot of practitioners do not focus on the role of the gut and dysbiosis and increased gut permeability as promoting GABA glutamate imbalance that can lead to increased pain perception. And again, also all sorts of other challenges with regard to increased emotional hypervigilance, anxiety, trouble getting to sleep in particular, sometimes staying asleep, but sometimes trouble getting to sleep, a lot of ruminating and worrying. And we've got to get that GABA glutamate balance back under control because the higher levels of glutamate can be in the way. Now, we also need nutrients in order to support GABA glutamate imbalance, and this is where we need good digestion in order to optimize the balance of nutrients that are available for keeping this neurotransmitter balance. Vitamin B6 is especially key. Magnesium is key for keeping GABA glutamate in balance. And if we are using a proton pump inhibitor, if we have that pancreatic insufficiency, if we have a dysbiosis, if we're taking NSAIDs that create wear and tear on the gut lining, all of these things are going to impair our ability to bring on board optimal levels of nutrition. And there's already plenty of lifestyle choices that overtly interfere with our ability to have good, solid nutrition. For example, women who are using oral estrogen-containing drugs like contraceptives have been shown over time to dramatically reduce our vitamin B6 levels, which can directly contribute to GABA glutamate imbalance and increase our anxiety and increase our pain perception. And so we can already be struggling with inadequate nutrients. And this is on top of the fact that many of the people we serve in our practices are eating the standard American diet or a similar other diet around the world that's full of a lot of crap food. Lots of calories, lots of chemicals, not very many nutrients, not a very nutrient dense food. They're getting plenty of calories, plenty of macronutrients. But they're probably also getting a lot of chemicals, a lot of toxins, and certainly not very much nutrition that is needed to fuel our biochemistry. And so we're often are starting off at a disadvantage with the quality of our food, but the status of our digestion, our stomach acid, our pancreatic function, the role of dysbiosis, the importance of the gut barrier integrity, all of these play a role in whether or not we're getting enough nutrition into the body to minimize our pain. to minimize the likelihood that we will have excessive inflammation that is overtly contributing to higher pain perception. And so I also want to talk about the role of food sensitivities. So many of the people in your practice who are struggling with chronic pain, part of that is being sustained or exacerbated by having an inflammatory reaction to a food. And this does not have to be a food allergy that's mediated by IgE antibodies and histamine. It can also be the immune system reacting to a food as a danger through other antibodies, in particular IgA or IgG. And IgG, for example, can build up and trigger the complement cascade and promote inflammation. And then when people eat this food, unbeknownst to them, they may or may not have GI symptoms, but it's increasing inflammation in the gut and contributing to pain. And so this can cause the body, when you're responding to a food from an immune viewpoint, the antibodies come and attach to the antigen and form immune complexes. And these immune complexes naturally increase inflammation most of the time. But the immune complexes themselves can circulate in the body and build up in areas of low circulation, like joints. And they physically take up space, and they actually trigger pain receptors, and in particular joint pain. It's not uncommon for people to have chronic joint pain and the progression of arthritis because the roots of the joint inflammation are in the gut, and what happened in the gut didn't stay in the gut. And the immune complexes that are getting trapped in joints and bringing inflammation there, bringing oxidative damage there that creates arthritis, the food can be causing that, or a dysbiosis, a microbial imbalance can be causing that. We need to always look in the gut for the roots of arthritis and arthritic pain. The other thing that is particularly essential about pain perception in the gut, I mentioned earlier with regard to nutrients, is our ability to produce serotonin. Because like anything else, again, our biochemistry runs on nutrients. We have to be able to make serotonin. And we need optimal levels of vitamin B6, of folate, of iron, but in particular of an essential amino acid called tryptophan in order to synthesize serotonin. And if we don't have optimal levels of serotonin from our diet to do so, we're going to struggle to make the optimal level of serotonin on an ongoing basis to make, optimal levels of tryptophan to make serotonin. And this is especially key for people in your practice who may struggle with high viral load. Now, this could be from COVID. This can be from a reactivating virus like Epstein-Barr or various herpes viruses. But the primary use of tryptophan in the human physiology is not to make serotonin. In fact, that's a really, really small but essential use of tryptophan. The vast lion's share of our tryptophan is used to go down a different pathway, the kynurenine pathway, that among other things helps us to make vitamin B3 or niacin, and also helps us to support the immune system in countering infections, especially high viral load. This means that a lot of people who are fighting viruses, again, whether it's Epstein-Barr because they've got Hashimoto's or herpes virus or COVID, right? When people are struggling with high viral load or frequent reactivation of a viral illness, they're going to naturally be pulling a lot of their tryptophan over into supporting macrophages to fight the virus. What this means is there may not be nearly enough tryptophan left, especially in a crap food diet. There may not be enough tryptophan left to optimally make serotonin. And people who have high viral loads can end up with lower serotonin levels. And in addition to struggling with all sorts of symptoms like chronic fatigue from these viruses, they will also end up with enhanced pain perception from a whole bunch of other insults. And so this is an important example of how we have to eat a sufficient nutrient-laden diet, we have to digest it well, we have to absorb those nutrients, and then we have to make those nutrients available for where we need them for diverse biochemical function. And the reality is that if we don't consume these nutrients, they're not available, right? We can't just go, looking in a cavity in the body for more nutrients, right? We don't have a pantry in our left butt cheek where we can just go get a little more tryptophan or go get a little more vitamin B12 or go get a little more vitamin B6. We have to eat these nutrients on an ongoing basis. In particular, the body only has about 2 days worth of amino acids available. It doesn't store huge amounts of amino acids unless we want the body to catabolize our own tissue in order to make those nutrients available, which it will do if necessary. We have to keep consuming good nutrient-rich food. B vitamins, right? We store a certain amount of vitamin B12 in our liver to varying degrees depending on our genetics. But these are water-soluble nutrients that we need to consume on a regular basis. And I mentioned vitamin B12 earlier. If we don't have good, strong stomach acid to make vitamin B12 well bound to intrinsic factors so it can be well absorbed later on in the small intestines, in the ileum, then we're going to struggle to have optimal vitamin B12 status, not just a normal serum value. There are lots of people who have insufficiency of a nutrient with a normal value, which is a great reminder, by the way, that normal ranges are not healthy ranges. They're not target ranges. They're just statistical ranges, 2 standard deviations around the norm of a person who doesn't have an overt diagnosis. But I think we all well acknowledge that there is a lot of disease and dysfunction inside normal ranges. And the optimal placement for serum B12 for most people is way up into the upper half or even the upper third of the normal range of serum B12. And if we don't have enough, then our nervous tissue is going to struggle, because vitamin B12 is essential for the integrity of nervous tissue. And when we struggle with dysfunction in the actual nervous tissue itself, it also is likely to increase our perception of pain. And certainly this is a known dynamic. We can end up with neuropathic pain, whether it's diabetic neuropathy. There can be trigeminal neuropathy. Individuals can struggle with challenges with integrity of the vagus nerve or transmission of the vagus nerve. Or we can have all sorts of challenges with neuropathic pain. Bursitis, this type of thing often has suboptimal B12 status at its roots. And so this is a great example of just where you want to focus. And it's even just only sticking our toe in looking at the huge variety of things that you can potentially learn to master about the gut, and being able to not only counter chronic pain in your patients and clients, but also get at the root of innumerable numbers of chronic disease. As I said in the beginning, whether your specialty is metabolic disease or autoimmune disease or fertility or longevity, you must master the gut, or you will never be able to help your patients to truly reverse the functional dynamics that are promoting disease so that it actually goes away. Really grateful to you for setting aside time to enhance your understanding, enhance your learning, so that together as a larger tribe of progressive practitioners, we can, on our watch, make true healthcare transformation a reality. Thank you so much. Have a great day.